We were diagnosed with hypospadias right away when he was born, and there was confusion immediately and fear immediately. To be told that your son has something that you've never heard of in your life, something that affects such a private area, was terrifying. Having no one to speak to about it, I think, was the hardest, because we only told our immediate family, our parents, not even siblings, and it was, something that they had also never heard about, so we had no community to go to. Being so young in age and not knowing what the rest of his life would be like, that was what was so scary and so isolating.
We hear this story nearly every day.
Families of a boy born with hypospadias tell us about the fear and the shame and the isolation that they feel, instead of the usual joy that a new baby brings.
And all that because this birth defect that we know is very common is not well known by most people because of the body part that it affects and their reluctance to talk about it.
So it's our goal here at the Hypospadias Specialty Center to bring hope and healing to these families.
Yeah, because the next time a boy is born with hypospadias, his parents should not have to go through this emotional turmoil that this mother and so many other parents have told us about.
That's especially true for families of boys who've had unsuccessful hypospadias repairs.
My son's birth defect took us by surprise. And at first, I was led to believe that it wasn't really a big deal, that one surgery and life would continue and really nobody would know about it. But after the first surgery, we realized that it really was a big deal. And I found that we were in a situation that I really didn't know what to do and what was best for him. And seeing that it was his private area, I didn't feel like I could really reach out to friends, family, the public. It wasn't something that I felt comfortable sharing.
It's very important that hypospadias be repaired right the first time, because when it doesn't go well, the risk for complications doubles with the next procedure and then goes even higher.
Hypospadias can be broken into three major components. Number one, the urinary channel is in the wrong spot. Number two, there's short skin on the undersurface. And number three, there's various degrees of curvature. So to repair it, we have to fix these one at a time. We have to make sure that the penis is straight. We have to be certain that there's good symmetric skin all around the penis and that the scrotum is dropped down to a normal spot. And then finally, we can work on the urinary channel.
So my name is Cameron. I'm a professional actor. I'm here to speak the words of people who are going through harder times than I am. The things that you're going to hear me say today are going to be the voice and the thoughts of people who are struggling and didn't want to be seen. How has hypospadia affected me? It leaves me with this shame. I didn't feel like it was something that I could ever talk about. I found out that I had hypospadias when I finally talked to my parents about it. I had a scar on my penis for as long as I could remember, but it wasn't something that I ever felt comfortable talking to anyone about. It was something that, when I was about 14, I started to really notice. And I mean, I didn't think anyone else had something like this. It took me 2 to 3 years after I realized that something was wrong for me to talk to my parents about this issue. When I finally did, I wish I had done it sooner.
When I left general urology to specialize in hypospadias, I asked myself, is this really important enough to devote my career to after treating men with cancer and stones and other things like that? And I think you've heard from the voices in this film today just how important that it is. That hypospadias doesn't just impact the patient, but also his parents and others in his relationships into the future. Hypospadias really does matter.
The Hypospadias Specialty Center helped, and they transformed our lives. They transformed his life. They completely fixed his birth defect. They undid what was done wrong in the first place. They aesthetically made him look like nothing ever happened. And after countless surgeries, I don't even see how that was possible, but it was. And emotionally, I found that the place that I was in a place of anger, they helped pull me out of that. They helped me help other people. And I felt like if other people can learn from and benefit from what we went through, then that's why my son went through what he did.
Our experience with the Hypospadias Specialty Center was life-changing. They explained everything to us and took their time and really made us feel like they knew what they were doing. And just that we were in the best hands possible with the best people possible. And I feel so indebted to them. Now my baby is perfect and he's completely normal, and if anyone were to look at him, they would see a normal, functioning, and looking penis, and that is life-changing and life-saving in my mind.